Your Excellencies, ladies and gentlemen, dear friends, I'm Nejib Friji. I'm the Senior Director of the International Peace Institute, Middle East and North Africa. I hope you are all fine and well. Thank you all for joining us today to the first of our IPI Global Humanitarian Series on the theme of pioneering humanitarian medical assistance. I would like to thank His Excellency Mr. Tirtha Rajwagal, Ambassador of the Federal Democratic Republic of Nepal, for putting us in touch with Dr. Ruit. And in that line, I would like to thank our key speakers for today, or thank him as a key speaker for today. Dr. Sanduk Ruit, ophthalmologist from Nepal, and the recipient of the 5th edition of the AISA Award for Service to Humanity, for his groundbreaking research on cataracts and humanitarian contributions. He saved the sight of more than 120,000 low-income people for free, as without treatment they would have lost or gone blind. Thank you so much, Doctor. In the multilateral system, it is generally agreed that humanitarian assistance means aid and action that is designed to alleviate suffering and protect human dignity while saving lives. Typically, this aid is framed as providing assistance to the aftermath of man-made crises and natural disasters. When the UN turned 70 years old, UN Secretary General Ban Ki-moon approached IPI to convene an independent review of the UN multilateral system and provide recommendations to make it fit for purpose. This gave birth to IPI's milestone report, the Independent Commission on Multilateralism, ICM. One of the focus areas was on the health sector, pandemics and public health. And among various recommendations, one stands out to me during this webinar. Partnerships with the private sector should be strengthened. There is a great potential for public-private sector partnerships in health, and these could include partnerships in research and development. In this regard, Dr. Ruit's humanitarian efforts are exemplary in cementing that community bridge between medical sector, private sector, and the needy. I look forward to hearing from Dr. Ruit on your humanitarian work and the ways in which it can provide the example for others to emulate. In this regard, IPI MENA invite ophthalmologists and private sector leaders who have a rich experience in conducting humanitarian medical work in remote areas in Tunisia and North Africa and beyond in Africa to assist people in need and preserve the site. I hope they join the efforts Dr. Ruit, or the efforts with Dr. Ruit, to further expand their noble initiatives in Africa and other continents. Before I give you the floor, dear doctor, just a reminder for our audience, once we open the floor for questions and answers, please either raise your hand through the virtual hand in the icon, one of the icons in your screen. Put your question in the chat or physically raise your hand and we will take note of it. Without further delay, the floor is yours, Dr. Ruit.
Can you hear me now? Good. Yeah. Your Excellencies and dignitaries, ladies and gentlemen, especially our dear ambassador in Bahrain, Mr. Tirth Wagle. And thank you very much for allowing me to take this platform, the prestigious Institute of Peace, International Peace Institute, IPI. And I'm going to be sharing you some of the experiences that I had in blindness alleviation, and also what I believe the work that we have done is a perfect example of what we are continuing to do and which we need to do a little more, a South-to-South cooperation, a technology that is developed in a developing country and that will work very well in another developing country. And I would like to share you as we progress further. And if you look at the issue of blindness, it's very well known that blindness shortens life expectancy, income, employment, and authority, and increases the burden. And these are the socio-economical impact of being blind, especially in a developed low-income and middle-income country. And if you look at the global blindness, about 36 million people are blind. And if you add the number of operable cataract, it's about 100 million. And unfortunately, close to 90%, close to 90% of this live in low income and middle income countries. And cataract by far is still the commonest cause of blindness. And it has been presumed that globally, a little more than 30 million cataract surgeries are done per year. And we actually need to do about 100 million surgeries per year. So at least there is a deficit of 70 million. And unfortunately, the large part of this deficit is in this part of the world, in low and middle income countries. And take you back with some of the work that I did way back in 1990 and before that. This surgical intervention of cataract was by removing the lens and giving the patients very thick glasses. And it was found that 60% of the patients after surgery wouldn't wear the glasses. It was very uncomfortable and optically very, very, it disorients the patients as the patient walks. And also it was found from surveys that because the old type of surgery led to very high percentage of patients going blind, as much as 6% of the cause of blindness was because of bad surgery. So we were touched by this, and early in our work, we decided that to provide modern cataract surgery to the community, at the community level, we need to make sure that surgery needs to be done in good numbers. Surgery needs to be successful in quality assurance. And it is very important in our part of the world to be sustainable. And I found that there were certain barriers way back in early 90s. And the most important barrier was the cost of the high quality intraocular lenses. That was the part and parcel of the modern cataract surgery. And the cost of these intraocular lenses were more than $100, sometimes $200. And a few companies really did, monopoly in these intraocular lenses. And the second barrier was to adapt a very good quality surgical technique, but make it adaptable and simple for the condition that we have in our part of the world. And the third was the cost and complexity of the equipment that goes along with the surgery. So we found that it was needed to have a very extremely powerful research and innovation. So we moved forward, and after about 5 years of struggle, we were able to finally, fight with technology and various other certifications, we were finally able to manufacture low-cost, high-quality intraocular lenses of less than $4 to those that used to cost normally $100 or more. And that was, I would believe, really a groundbreaking sort of a process, and created a little bit of a history. And it was important that we continue into newer products for this. And type of the surgery now came within the reach of the poorer community. And before this, few thousand people were under the target group of the surgery. Now millions of people stayed within the target of the surgery. And for us to reach to this, of course, I encountered a lot of challenges, a lot of obstacles, but it was possible to do this. Now, the second was looking, along with the manufacture of the intraocular lenses, the certification was very important, that we manufacture every lens that coming out of the laboratory has to be of top quality. And we managed to do that. Until now, we have distributed about 6 million lenses to 80 countries around the world. And most of these people were otherwise patients who could not afford that intraocular lenses and that type of surgery finally, And the second thing that we simultaneously tried to do in the late 80s and early 90s was to find a surgical technique that was adaptable, simple, still not compromising on the quality. So we tried to develop the surgical technique in the most difficult situations. And high volume ambulatory surgery was instituted as early as 1994. And one of the first institutes in developing country to institute what is now become a usual thing, ambulatory surgery. So, and the other thing that we did was to institute a cost recovery, whereby we subsidized the pricing tier, arranging a pricing tier. We subsidized through cross subsidy. So patients who were able to pay are allowed to pay full, and patients who can pay less are subsidized, and we still allowed patients who cannot pay allowed to have same quality of surgery. And this was, in fact, very important for sustainability. And of course, surgical modification and production line approach to address the volume of the patient. And to adapt this surgical technique, it took us a little more than 5 years. We finally simplified, adapted, and tested, and fine-tuned, and started training globally. And Africa was, in fact, in early 90s, was one of the continents that we did a lot of training programs in different parts of Africa, and started to get popular. We created standard operating procedure manuals, and along with our partnering organizations, the Fred Hollows Foundation and the Himalayan Cataract Project. And as the surgery started to, work in different parts of the world, the small incision cataract surgery, and there were still a lot of criticisms from our own colleagues from developed world, from organizers, from managers, that this surgery is too complex, too expensive, still for a developing country. And people will always, say, there are always people who will say, this is wrong, that is wrong. So finally, we thought it's best for us to do a clinical trial. And we invited the famous Dr. David Chang, who is almost synonymous with modern cataract surgery in the United States of America. And he and I did a clinical trial, randomized clinical trial on the surgical technique. And we studied, the patients after the surgery for 6 months, for 1 year, And we found that at the end, continuously at each state, even after 1 year, the results were comparable in the two technique. And the only difference was the surgical technique that he did, the cost was about 20 times more than the one that we did. So it was very expensive. Yeah. And by and large, if you look at cataract surgery, it is fairly straightforward, predictable, quality assured. But when you do it in community, it continues to be a challenge. And that's where we are very good at. Now I'd like to share with you an example of a low-income family member who suffers from blindness, the effect of blindness in the society and the economics and the whole orchestra of the family. And what happens after this simple intervention, what happens to the family after sight restoration. So if you look at this lady, she's about 29 years old, and she has just given a birth to an infant who is about 9 months old. And because she had been blind for 3 years, her husband discarded her from the family, and she went and lived with her brother. She was, and as we did surgery, she was living with the brother, and we took her up for surgery. You can just see her. And she's a lady who has almost total cataract in both eyes. And this actually represents a low-income lady, could be anywhere from Asia, Pacific, or Africa, or even South America, you know. Simple surgical technique is applied, and you will see that in just when the patch is removed, you will see all the wrinkles that she has in her face disappears. Now, the most interesting thing is her child, the infant, living with her now with her brother. The infant is actually very malnourished, and she couldn't look after him. So, but you know, the really the joy of seeing her child for the first time in her life. This is 6 years after surgery. We went back to see her, and we found that she was back with her husband, totally running the house and the family affairs, looking after the farm. And the son has grown up to a school-going kid. After the surgery, she's able to negotiate some of the most difficult roads in the world. You can imagine why good vision is very, very needed, very essential for this part of the world. She was able to look after her infant son, and now the son is school going. And she's back with her husband in the field and getting into the details of our family affairs, and our social and affairs that are related to the society. So it's become very important members of economically viable family member. The effect of blindness elevation in the family and the society that you saw very clearly, and some of the activities that we were involved in was training lots of ophthalmologists, and we have trained until very close to about 800 eye doctors from around the world, probably about more than 40 countries from all over the world. And then the surgical, process was, replicated in Vietnam in 1990. And we went to China in 1994. Many parts of China, we trained lots of doctors and technicians. In Bhutan, in Thailand, many Asian countries, for example, DPR, Korea, Indonesia, Myanmar, because the surgical technique and the system was addressing the local conditions, local socio-economical conditions, it was very popular in this part of the world, something that was doable. And Ethiopia. So what I wanted to say was that we as an organization, as a team, we can replicate this system anywhere in the low and middle income countries. We can do surgical training. We can look at sustainability. We can help in strategic management plan for the country. And we can also make sure that it is assured in terms of quality. And with some help, we'll be able to bring in some resources too. And what Your Excellencies and others can do is, if you can link us up with a local partner from that country, help us in the logistics of the program, and support from the health ministry, I'm sure this can be taken to many, many countries, and we are very keen to take it to many countries. We have a close collaboration, Fred Hollows Foundation, Kilganga Institute of Ophthalmology, TKRF, and Himalayan Cataract Project. We aim to do about 100,000 surgeries every year, or probably more. And it's something that I see as a great example of working, forging together in developing countries, and together we can make it much better to clear the backlog from especially from the low and middle income countries. Thank you very much. Over to you.
In fact, thank you. Dr. Sanduk Ruit for this impressive presentation about a most impressive journey, a humanitarian journey. I congratulate you again.
Yes, sir.
And then renew our gratitude to the Kingdom of Bahrain that granted you the ISA Award.
Yes, sir.
That is richly deserved recognition, and hopefully as you launch the appeal, many more would join you. We will do our best to connect you with people who are engaging in terms of helping the people in need to restore one of the most vital and instrumental feelings or senses, which is sight. I cannot thank you enough. I will ask my colleagues here, my friends, if they want to put more questions, but more importantly is that I think we should heed the call by Dr. Ruit and start working as of now to put him and his team in touch with similar experiences in Africa or in the Middle East and North Africa where we are based. And we will look for other forms of, I would say, to find opportunities for you with a kind of targeted audience of ophthalmologists and private sector and eventually ministries of health where you could share your valuable experience. I know many countries have done great work in that regard, and they don't seem to face the same challenges that you tackle in different countries, that from Ethiopia to Vietnam to Myanmar to others. But maybe this is a humanitarian work where all efforts should be put together in order to tackle this challenge that has no reason to continue to exist. And I'm so impressed by the images that you shared with this young woman who lost her sight and lost her household, in fact. But when you restored the sight, you restored many other things. But on top of that, the capability of seeing again and the dignity of becoming an active woman to chart those very difficult roads that you referred to. I can't thank you enough, really, Dr. Ruit, and I'm impressed by your work, and congratulations. Any question? Any questions from my friends? Yes, yes, Ambassador, please. Ambassador,
good morning.
Islam.
Thank you, Nejib, Friji. Thank you, IPI, for Sanduk Ruit. And let me congratulate again Dr. Sanduk getting the award. I was present, so I could not. And thanks, Excellency, Ambassador of Nepal, arranging this. And I have learned many things. And his contribution to alleviating blindness, really remarkable. And really in the low income and the other. It has been a significant. My question to Dr. Sanduk Ruit, have you tried or started operation in Bangladesh? The Bangladesh being neighbor to, I understand perhaps you have some collaboration. If not, then actually Friday and this morning I talked to some non-government of those who are working. They are very much willing to have collaboration. protecting
Yes.
treatment, cataract, surgery, collaboration, because you have achieved a significant cost and also time. So that's my submission. And thank you again.
Yes. Nejib, can I answer that His Excellency's question, Nejib?
Please go ahead.
Yeah. Your Excellency, thank you very much for a wonderful question that you put forward. And Bangladesh being our neighbor, as you correctly said, we have been requested by the Bangladesh Ophthalmological Society. And I'm not sure, but I think they are in the process of inviting us. But indirectly, we are also working through the Fred Hollows Foundation in Bangladesh, doing quite a lot of surgeries through the local doctors. The whole idea, Your Excellency, is to go and show the surgical system and show how it works, and then maybe show it twice or thrice. Then it's for the local doctors to continue that and sustainability. And we have some good willing donors who can be with us during this process. And hopefully we can take this to Bangladesh soon enough, as Your Excellency's. And this is where Your Excellency's role is to make our visa easy, our certification easy, and connection with the local people easy. And that's where we really want Your Excellencies and the dignitaries from the host countries to help us. Thank you so much, sir.
Thank you indeed. Thank you, Ambassador, for raising the question, and thank you for the valuable advice Dr. Ruit extended. I'm wondering whether Professor Khalil, vous nous écoutez?
Yes, I'm here. Hello.
Yeah. Good morning.
Yes,
This is Professor Khalil, Khalil Rais, who's a professor and ophthalmologist in Tunisia. And if you can, even in French, or I'm pretty sure your English is fine. If you can tell us about the situation of the humanitarian work in site recovery in Tunisia, that would be great.
Okay, thank you to make me associate to this event. I'm very happy to share with you the experience, the Tunisian experience. I've had the curiosity to check the background of Professor Ruit. He has done a real great work on struggling and trying to take care of the blindness due to cataract in the whole world. I'm the General Secretary of the Tunisian Ophthalmological Society. And we had every year in our Congress a session on preventing blindness, and we'll be happy to host Dr. Ruit in our session. On the action on prevention of cataract in Tunisia and even in sub-Saharan countries, we have many governmental and non-governmental associations who are working on that since 30 years. And we have done and scheduled with these associations many cataract surgery campaigns, even in Tunisia, in regions which lack cataract surgery institution, and even in sub-Saharan countries, Burkina Faso and Guinea. Even I've been to South Africa in 2003, and many of our colleagues have participated to these campaigns. Things are moving, and as Dr. Ruit said, we try to develop surgical techniques which are not expensive, using basic instruments with good results. And this is essential. As he said, we are developing what we call SIX. It's a basic cataract surgery, which needs a few instruments. It doesn't need what we call the phaco machine, expensive machine, phacoemulsification, and things make these campaigns with low and very cheap means. So I thank you again to make me participate to this event, and I hope for further collaboration with all of you. Thank you again.
Professor Khalil, we will share with you the contacts of Dr. Sanduk Ruit, and then you take it from there with him directly. And I'm glad you're pledging to put hand in hand, go hand in hand in further expanding this valuable experience.
Thanks a lot.
Ria, you'd like to take the floor? Is Dia there? Okay. Any further question? I see none. Yes, yes, Ambassador of Nepal.
Ambassador, sir.
Thank you very much, Excellencies, ambassadors, distinguished participants. Good morning here and good afternoon in Nepal. Thank you, Senior Director Nejib, for your initiative, really in organizing this very important webinar on Humanitarian Leaders Series. Thank you so much for your amazing moderation as well. We already had engaging discussion and we listened to Dr. Ruit, so I'll be very brief. First of all, my sincere gratitude to ISA Award laureate, Dr. Sanduk Ruit, for taking time out of your very, very busy schedule and sharing with us your brilliant ideas and vision. Your devotion and commitment to humanitarian service is exceptional. We are so proud of you, Dr. Your achievements and your accomplishments in bringing light to the people most in need and the recognition of your outstanding humanitarian service by the ISA Award for Service to Humanity has already shown brighter light in Nepal-Bahrain relations. I would like to convey our profound gratitude and appreciation to His Majesty the King of the Kingdom of Bahrain and the ISA Award Board of Trustees for honoring Dr. Ruit with the 5th edition of the prestigious ISA Award for Service to Humanity. Indeed, we are honored and privileged to have this new platform to listen to Dr. Ruit. We are truly inspired by Dr. Ruit's invaluable perspectives on fostering South-South cooperation in affordable and high-quality eye care services. We look forward to working closely with Excellencies, ambassadors, distinguished dignitaries, and friends here in the Kingdom and around the world. Thank you, IPI, for this opportunity today. Thank you so much. And also, in 2 days, there is Ramadan beginning. So, Ramadan Mubarak to everyone. Thank you and namaskar.
Thank you, Your Excellency, my friend, Ambassador of Nepal. Thank you for you personally made this possible with your efforts, despite, as you said, the very tight schedule of Dr. Ruit. And I think if we manage in the future to have further interaction with Dr. Ruit and his team, we will help this noble effort and inspiring initiative to as much or as many countries and as many people in need. With that, if I don't see further questions, I will conclude by thanking you all, and we will get in touch with you offline, Dr. Ruit, for further actions regarding linking you to our friends in Tunisia and others in the Middle East and North Africa. Thank you again, everybody. Enjoy.
Thank you.
The rest of the day, and thank you for congratulations, Your Excellency Ambassador, for Ramadan Kareem. Let's make it a month of solidarity, as this is the sense of Ramadan, a sense of partnership, tolerance, and assistance to those in need. Shukran. Thank you.